So when somebody who has diabetes changes to a plant-based diet, overall, they're going to feel great. And the side effects are all beneficial. But there is one important thing to know about, and that is that medication can all of a sudden become too strong. There are some medications that lower blood sugar. And if a person is taking one of those pills or taking insulin, they need to know how to recognize low blood sugar and what to do about it. And then they need to work with their healthcare professional to cut back or even eliminate medications. So it's important to know what low blood sugar feels like. And I always say it's sort of like the way you feel if you go too long without eating. You might get a headache, you might get grouchy. For people who are on these medications, they might start to feel shaky or sweaty or lightheaded. But the most critical thing is usually it comes on pretty suddenly. You feel fine and then all of a sudden, you just notice you don't feel right. And that's the time to get something to eat or drink. And the treatment for low blood sugar is 80 calories of something that would be digested quickly. So a glass of juice, half a can of regular pop, 3 or 4 glucose tablets that they sell at the drugstore. And it's just a good idea, if you're on any of these medications, to have that treatment with you. If you're going out for a long drive, you're going to be away from home, have some glucose tablets in your purse or in your car. Not a bad thing to have on the nightstand so that you don't have to get up and go to the kitchen in the middle of the night. And I just like to encourage people to be prepared. Now, it's a good thing if it starts happening, because then you know that this diet is working and you don't need those medications anymore. So you want to let your healthcare professional know that this is happening. If you've got a meter and you're checking your blood sugar and you start seeing readings in the 70s, 80s, 90s, whatever you've been told is too low for you, let your nurse practitioner or your doctor or your PA know so that they can help you determine which medications to cut back on. I also want to mention, if you are being treated for high blood pressure and you're on blood pressure medication, that all of a sudden can become too strong too. And the way you'll know is if you've been sitting for a while or you've been in bed and you get up quickly and you start to feel dizzy. That's a sign you're getting too much medication. So again, let your healthcare professional know to help you cut back on your medication. Now, just one more word of caution. Let's say you're doing great with this new way of eating, you feel great, you go off all your medication, and you slide and you go back to your old way of eating. You will need those medications again. It's not a permanent cure, although it may be. And if you continue to eat this way, as many people do, you may find you don't need those medications again. But I always encourage people to work with their healthcare provider so that you can do this safely.